a second year, third year, I think the importance of step one is going to diminish. However, if you're final year right now, listening to me, the value of step one score might remain for another year or 2 years, but they're phasing that out because becoming pass fail starting from January of 2022. So anyone who has taken the exam before January 22, they might look at your score. However, like for example, for Ibrahim here, like since he's second year, by the time he gets to that stage, matters. But the thing that's going to matter is step 2 CK, letter of recommendations. Step 3, research publication, US clinical experience, connections, and any kind of safarish or anything that you have going for your corner. And you want to create a profile that has ideally brand name institutions on it. Like a brand name could be anything big name, from UPMC to Hopkins to anything that you can do to augment that. So coming back to your question about how to prepare for steps, I would say the focus has to be on step 2 CK and step 3 to begin with. I know another thing that you guys, I feel I've heard of at least, struggle with is that your schooling is not catered towards USMLE compared to say King Edward or Aga Khan, where the whole schooling 99% of class comes to the United States. So I think that's something that you guys might have to work extra hard to get acquainted with. And there are multiple resources, multiple forums, depending on your strength and weakness and what subjects you feel strong and weaker in. You should make at least 6 months to your preparation. And what I would recommend is start studying from final year. Do not wait until you graduate and doing that, because you want to get in within 3 years of graduation, ideally, because some school won't even look at your file if you're more than 3 years out from graduation. So I think strategically speaking, we can go over resources, any specific question that you have. But I would like to begin with is that you guys, if you're second, third, or fourth year here, you should focus on step 2 CK and step 3. And step 1, Allah khair say, it's just pass fail at this stage. But yeah, go ahead if you have any specific questions regarding that.
Form is open for question. Anyone who want to ask a question, raise your hand.
Yeah, you guys don't worry. I don't bite, so you can ask me any questions without any hesitation or any takalluf and anything like that. So I'm here for you guys. Bismillah.
Assalamu alaikum, everyone. So my name is Dr. Zarek Rashid Khan. Ibrahim and Dr. Sayed already know me. Or
yes.
जो नहीं जानते, तो I am resident in Hyderabad Medical Complex, Peshawar.
Right.
So आपकी तरह मैं भी इस साल मैच के लिए अप्लाई कर रहा हूँ. मैं थोड़ा सा आप लोगों से आगे हूँ क्योंकि मैं स्टेप 1 और 2 दे चुका हूँ. तो सईद भाई ने मुझे ऑलरेडी काफ़ी गाइड कर चुके हैं, तो मुझे लगा कि जिस तरह उन्होंने मुझे गाइड किया है तो आप लोगों को इस वक्त गाइड करेंगे. तो मुझे फील हुआ कि मुझसे काफ़ी टाइम गुजर गया था. मुझे ऐसी चीज़ों का पता चला कि मुझे लगा कि मुझे पहले पता चलता तो शायद मैं बेहतर कर पाता. तो इसलिए मैंने सईद भाई को इनविटेशन दी कि अभी से आप लोग आप प्रिपेयर कर सके. तो मुझे लगता है कि ज़्यादा बेहतर क्वेश्चन सईद भाई से ये होगा क्योंकि शायद उनको तैयारी किए हुए साल गुजर गए हैं. तो जो अब रीसेंट गाइडलाइंस है और जब रिसेंटली जो लोग प्रिपेयर करते हैं वो थोड़ा सा डिफरेंट होगा उससे. तो आप लोग के लिए स्टेज पे मैं सईद भाई से पूछना चाहूँगा कि क्या ऐसा आप लोग इस स्टेज पे कर सकते हैं, इंक्लूडिंग आप क्लिनिकल्स की इलेक्टिव्स की बात कर लें यूएस में, जो इनको इस स्टेज पे फ़ायदा कर सकते हैं. क्योंकि हमारे पास यहाँ पे स्टूडेंट्स हैं फर्स्ट ईयर के, सेकंड ईयर के, थर्ड ईयर के ना. तो शायद एकेडमिक वाइज या स्टेप 1 और 2 की तैयारी के बजाय आपको ज़्यादा उस चीज़ पे फोकस करना चाहिए. सईद भाई इस बारे में ज़्यादा बेहतर बता सकते हैं.
I think is बहुत अच्छा point, is a very good point. The biggest struggle is to get rotations in the US. Common mistake that I have seen जो मैंने देखी है, especially students जो KPK के हैं compared to other institution, आप लोगों को मुझे लगता है relatively speaking awareness थोड़ी कम है in terms of के if you do rotation, don't go to a community program, go private clinic वगैरह. Problem is that अगर you need a guy that has a big name. Like अगर आप if you go to Lahore and whatever city, and then you're going to अगर आप you buy something that's good and brand name. So if you do at a community-based program, if you get a letter recommendation there, it's better than nothing, but it's not going to have that impact factor because nobody's going to know that guy. But if you go to a big name institution, like any institution, academic-wise, UPMC, University of Pittsburgh Medical Center, or Cleveland Clinic, or Harvard, or Yale, or Hopkins, whatever, it helps because when people look at that letter, oh, this is from a big name place, and it carries more weight, it has more effect. So unfortunately, and Zarak knows this too, we have common friends that at Khyber Medical and other places. And what happened to those guys was they did rotations. They took out time from the final year, fourth year, and they did rotation at community centers, so community clinics, private clinics. They got letters and unfortunately did not match. And one of the big reason I felt was that the letter of recommendation, nobody recognized who that is. And that's unfortunate, but that's how things work. So in any country, including the US, brand name matters. If you get from an academic center, it's going to help you. People know each other in academics. And when you train, you train academics primarily. So it helps with that. So I think the biggest challenge would be, from what I've heard is, at least at my institution, what I'm hearing is that from next year, they might start doing the rotation. Right now, it's very hard to get a rotation at my institution and some other surrounding institutions, like including Yale and Harvard, from what I understand from our network is, because they're afraid of the COVID thing, and then visa is being a bit of an issue and hassle. But from next year, things might start to improve where you might be able to better travel, and there might be less restrictions in terms of getting rotations. And yeah, Kwazar, you saying something?
Excuse me, sir.
Yes.
सर जैसा कि मोस्ट ऑफ द स्टूडेंट जिसने ज्वाइन किया ये तकरीबन फर्स्ट सेकंड थर्ड ईयर और फोर्थ ईयर फाइनल ईयर तक है सर, तो अभी इस स्टेज पर हमने क्या करना चाहिए? मतलब अभी क्योंकि इतनी ज़्यादा मुश्किल प्रॉप है, हम बस सिर्फ प्रॉप के लिए इतना पढ़ते हैं कि बस हम सिर्फ 50% स्कोर करके हम सिर्फ पास किया जाए और पास करें एग्जाम को। तो यूएसएमएल और सर इन जैसे एग्जाम्स के लिए सर अभी से हमने क्या करना चाहिए? मतलब सर कोई अगर एक्स्ट्रा बुक्स रिकमेंडेड है या जो हमारे करिकुलम में जो बुक है बस वही पर फोकस करनी चाहिए, या क्लिनिकल को रिलेटेड जो बाकी चीज़ें हैं जो कि फोकस होनी चाहिए? क्योंकि ज़्यादातर स्टूडेंट सर 90% स्टूडेंट जो होते हैं सर इंक्लूडिंग मी के सर बस हम सिर्फ ये ट्राई करते हैं कि सिर्फ 50% मार्क्स हमारे आ जाए और हम पास करें प्रॉप सर।
Arshad Khan, I think you made a very good point, and I recognize that कि आप लोगों के साथ there's a disadvantage because I feel like your school does not cater your needs, does not give you elective time, and maybe the curriculum, I'm not sure, but from what I've heard from my relatives and friends, KPK, or at least in some other school like Khyber or Youth Medical College, that the curriculum is not catered towards USMLE studying. It's like different pattern, maybe it's more British, I'm not sure what it is. मैं जो आपको encourage करूँगा is that if you're gonna study, try to do like review question that there's USMLE RX है, आप at the same time just get into the habit of thinking to answer the question. Unfortunately, it's not about just what you know, but how you answer the question that's going to get you a good score. You see the score, you don't see how much a person knows, and there's a discrepancy sometimes in that. So what I would encourage you guys is, agar prof ke liye aap padh rahe hain, take out time and do USMLE RX. Take like you don't want to use up your U-World question bank. That's for the proper. But some other supplemental question banks say, I think USMLE RX, and there's another one too. I can't remember because my younger brother, he just took the step 1 last year. He goes to med school in California. So there's some other good ones that are coming in. So you should get into the habit of doing questions while you're studying for these exams. So you hit 2 birds with the same stone. You study for your props, and also you get into the habit of thinking of how those questions are going to be designed to test you.
सर क्लिनिकल पॉइंट ऑफ व्यू से सर जो मतलब हम बुक संभाल रहे जो हम फॉलो कर रहे हैं सर, तो अभी हम मतलब सेकंड ईयर थर्ड ईयर के स्टूडेंट्स हैं, तो इस स्टेज पर सर और यूएसएमएलई का जो स्टेप 1 है वो उनके लिए कोई क्लिनिकल को रिलेटेड चीज़ों को पढ़नी चाहिए या कि जो करिकुलम में जो बेसिक चीज़ है उनको पढ़नी चाहिए?
No, I think वो step 1 का pattern is changing now. They're making more clinical something, but the problem with step 1 is that it's going to become pass-fail from January of next year. So unfortunately, the score is not going to matter. It's just going to be pass-fail. I think the real question should be about, in my opinion, should be about step 2 CK and possibly step 3, because those exams are going to get more important. As a US grad, you don't take step 3 until you start residency, but as an IMG, you guys have an advantage. You'll have an extra score compared to some other local grads or Caribbean grads. So some of the people go to Caribbean too, and they're also considered IMG to US से चले जाते हैं when they can't get into school in the US. तो मैं तो यही encourage करूँगा कि अगर आप study करें तो clinical correlation करें step 1 की, but since it's like a pass-fail thing, I won't kill yourself over it. Your focus should be on step 2 CK, which is pretty much all clinical. It's got some basic science thing, but it's mostly clinical correlation, what you see in the wards or what you see in your daily cases, workup, diagnosis. Step 3 is more like treatment and management. So you should get into the habit of what tests to order, what kind of lab profiles are going to be elevated with certain things, and try to keep an eye on that and do the questions. I think when you do questions, after reading, it helps to retain things better and helps to recall as well.
Assalamu alaikum, sir.
Islam.
Sir, I'm sir, मैं second year MBBS student हूँ Frontier Medical College से. मेरा एक ही सवाल है सर आपसे.
Yes, yes.
कि सर next year जैसे आपने कहा कि ये USMLE pass and fail पे shift हो रहे हैं सर, तो majority सारे like Asia हर जगह से apply करते हैं USMLE के लिए.
Yeah.
सारे लोग एक ही like full pass करेंगे pass और fail पे. जो लोग इसको पास करेंगे सारे एक ही फॉरम पे होंगे, तो हमें फिर हम और इन्वेस्टमेंट इसमें करेंगे, लाइक ऑब्जर्वरशिप्स करेंगे, यूएस आएंगे, इलेक्टिव्स करेंगे, ये सारी चीजें हम करेंगे सर. लाइक सर लाइक हम अपने सीवी पे वर्क करेंगे ना, तो लाइक इसलिए मैं पूछ रहा हूँ कि
श्योर. सॉरी, आपका क्वेश्चन क्या है एग्जैक्टली? जस्ट वांट टू मेक श्योर.
मेरा क्वेश्चन ये है कि लाइक वी हैव टू वर्क ऑन ये सीवी मोर के हमें सीवी पर और वर्क करना चाहिए. हम इलेक्टिव्स करेंगे, ये चीजें करेंगे, लाइक सारे लोग एक ही पास करेंगे ना, ये पास और फेल पे चले जाएगा.
True. Yeah. I think the main thing is जैसे आपने कहा कि CV is going to be more important in terms of your publications. I don't know if your rotations are graded or not. They probably don't look at med school grades or research person like international journals. You should think about seeing if you can make some publications in that, rotations, letter recommendation. And when I say letter recommendation, I mean US-based letter recommendation also, which people will recognize and they will know at big institutions, academic institutions. And obviously, other things would be is knowing people, getting well connected. That's how you, when you do rotations, you need to have a mindset that I want to make a good impression, but I also want to get well connected with people who are going to make decisions about me, the residency, like chief resident, like program director, associate program directors. You have to be best friends with them. You have to make a really good impression. And when you do a rotation, you should leave your mark. You leave a legacy. And how you leave a legacy is that you ask them, hey, I'm really interested in a project. While you're on the rotation, start a project with them. Like, I'll help you with the data collection. So even after you leave, you're still in contact with them and you have a good reason to be in contact with them. People, like you said, come from all over Asia, Africa, South America, you name it. People, come. And so you want to be a guy that they'll remember. And the way they'll remember is if you keep in touch with them through some kind of a platform, a forum, or some kind of a reason. So doing a research collaboration with them, doing a publication, even a case report with them is going to help them remember you. And also when they pull up your file, this guy, he did a publication with this guy, and, it gives you a heads up or legs up in the game.
Like, sir, from next year, you similarly don't matter. The main thing is our research, other things matter.
USMLE step 1 doesn't matter. Step 2 CK is going to get more important.
Okay, sir. Thank you.
Any step 2 CK, there's no shifting on that.
Yes.
Well on that, sir. Yeah. And step 3 also. I'll encourage you guys to take step 3 because I can tell you, like, people in other places already are strategizing the step 3 and step 2 CK is going to get more and more important. But you're right. Yeah. I think the CV is going to get relatively more important after step 1 goes out the window.
Yeah. Sir, I want to ask regarding tele rotation. Sorry.
Sure, but
sir, I was asking regarding the tele rotation. Should we join any tele rotation or not? Is it recommended?
I'll recommend it, man. Yeah, absolutely. Anything goes. From what I've heard is from next year they'll start making rotations in person because they're thinking after the COVID booster shot. And when we reach a critical mass of vaccinations, they might open up the gates to get people rotation, because they make money on issue rotation. There's several places doing tele-rotation. You can Google those places. And I think there's somebody here who started here as well. I heard about it. Maybe I can let you guys know later who's doing that. But a lot of academic institutions are starting tele-rotations. And maybe next year, inshallah, it might become in person. I think doing person is preferable because people make connections better and you make better impression. Anybody can sit on Zoom and do it. But when you're with that person, they're seeing how you perform, how you take history, how you interact with the patients. I think that goes a longer mile.
Thank you, sir.
Assalamu alaikum, sir. Sir, my name is Syed Mohammad Hassan Ali Shah, and I'm a second year BDS student studying at Frontier Medical College. Sir, can I ask that, sir, what is the pathway to do USMLE after BDS? What are the protocols? What are the decorum to pursue?
You mean after dental school?
Yes, sir.
Oh, I see. Yeah. And I don't think you'll qualify for USMLE. I think what you need to look into is a dental exam. There are certain programs, and I knew a relative of mine, she did dental school, I think you have like a dental school at Khyber, I think, and she basically had to go to New York, or New York has a program, where, NYU and Boston University also has a program where international dental students can apply for accreditation. And I think you have to do 2 years of schooling. There's an exam you have to take. I don't know the exact name of the exam, but it's not USMLE. You have to take some other exam. I can't remember the exact name. And after you take the exam, you can apply to at least these two schools I know take international dental students for training. And after you do 2-year training, they'll give you, you can practice dentistry in the United States. Yeah. But it's some other, it's not USMLE. USMLE is mostly just for medical students.
Assalamu alaikum, sir.
Sir,
I am Naveed Khan, a student of second year MBBS. Sir, I have a question that what strategy we must have to follow in our mind for USMLE in these academic years of MBBS, sir?
I think the big strategy, like you guys are making a good start today, I guess if you're here, you are focused and you're trying to align your goals, but these things take planning, these things take time. So the earlier you start, the better. So congratulations on that first step. The biggest thing I can say is that, like I was telling, I think it was Arshad Khan earlier, that you want to start getting into the habit of studying and answering questions that are going to be like the USMLE, like USMLE RX, and there's some other questions banks that you can do. While you're studying, you're doing the basic thing like physiology, pathology, pharmacology. When you do a section and when you finish a topic, start the questions on that and go over those questions. It would really help you get into that mindset of answering questions and going, recall faster, because those questions have long question stems, and it will help you get your mindset in the same realm. And even like things like Boards Beyond Borders, I think there's like multiple I used back in the day. And, you can use these resources. So when you have questions that are touching a multiple concept, it's going to be easier for you to recall and connect the dots. And that's going to come with practice. Like I said, you can read a chapter, ratify it, do everything, but you will have to know how to think in terms of the questions. And that's going to come when you guys start doing it now, sort of 2 years, you'll be ready. No worries.
Thank you, sir.
Hello, Shahil, ask you.
Hello,
Yes.
Assalamu
Well,
My name is Shajil. I'm in first year MBBS. So my question was that how important is the USMLE scores relative to extracurriculars? Since you said USMLE step 1 is now going to be pass or fail, so how relative would it be for extracurriculars versus for example, an applicant comes with a super strong USMLE step 2 score, but he doesn't have a lot of extracurriculars, versus a student who comes who has a relatively weaker USMLE step 2 score, but a lot stronger extracurriculars. How would you rate? I mean,
sure.
You get my question, right?
Yeah, I get it.
Okay.
I think the main thing for, look, if you're an IMG steps, so there's one thing that we need to recognize, and that's a good question by, I think, Sergio.
Yeah.
Sergio here, that extracurriculars was a step. You have to think about, like, when they get your applications in ERAS or the residency process, they have filters in place, computer-based filters, and the first filter is done by the secretary or the administrator. They're not really involved. They put a filter, hey, anyone below this board score is not going to make the filter, so they're not even going to look at your application. Unfortunately, a lot of places do it like that because they got so many applications, and that's the way they make it easier for them. A lot of these guys are full practices, program directors and stuff. They get maybe like, half a session or 4 hours per week to do this job, and they want to make it easier for them. So what they're going to put is like filters for step scores. So yeah, you're right. When you pass that filter, then extracurricular activities would matter. And relatively speaking, I mean, your board scores should be at least, there's averages in frida.com, FRIEDA. I think that's the portal for residency scores. So you want to make sure you're above that filter before extracurriculars will even come into play. I think in this day and age, extracurriculars, the more you do it, the better. But obviously, it should not compromise your board scores. Like, you're right. If somebody has a 245 and another guy did like Red Crescent and he did like blood drives and some international medication, when he came to the US, he got involved with some international medical projects. Obviously, that guy is going to stand out more. But for that to happen, he needs to make it past that filter. That'll be the first step.
Thank you, sir.
और किसी का कोई क्वेश्चन है तो काइंडली आस्क फ्रॉम सर.
One more question, sorry.
Yeah, go ahead.
So like for extracurriculars, like what would you like recommend that would be like essentially like good extracurriculars? Like would a job matter? Would like, I mean, I know like research papers, they matter, but like would a job, like would it be helpful? Like, if you like do a job like with med school, or is it like
what kind of job? It would depend on that.
Like
doing some, yeah, go ahead.
Like for example, if you're like working at a pharmacy, right? Like if you're just working at a pharmacy, or like if you're like essentially like a helper, or like even like shadowing, like would that be like considered like a good extracurricular?
I don't think it's going to be, at least in Pakistan, I don't know how much shadowing is going to do. You want to do something that are internationally recognized, like something like COVID vaccine thing right now. Polio, Pakistan is one of the, I think, only 2 countries in the world that has polio still. So something like that would stand out, like polio. Everybody knows that Pakistan and Afghanistan are only 2 countries that are left in the world. India has wiped it out. So something like that, which they would recognize, they can relate with. If you do something that, they don't get it or they don't understand, it might not stand out. But something that is a public health issue, like COVID or vaccines or something like that, would stand out to be a more worthwhile curricular activity.
And like, would you like also like recommend like a hobby, right? So like not like medically like related, but like another hobby that like, just I guess like makes you like a well-rounded person, right?
Yeah, absolutely well-rounded. I think the thing about hobbies is you can get all the hobbies in the world, so nobody can cross-check that.
Yeah.
But yeah, you should put that like, hey, I love playing cricket, baseball, basketball, what have you.
Okay.
Or
all right, cool. Thank you.
Sir, Zoom meeting अगर हम rejoin करें तो please.
Hello, sorry.
सर Zoom का meeting time जो 40 मिनट का था सर, वो time out हो रहा है, तो अगर हम rejoin करें meeting को सर.
Oh, sure, okay. No worries.
Thank you, sir. Everybody, please rejoin the meeting.
Mandatory for USMLE.
You mean is USMLE mandatory?
Yeah, IELTS, sir. IELTS test, English language test, sir.
Yeah, I think because CS has been suspended for, I think they finished it now. They were thinking about suspending it for a while. I think it is, from what I've heard, the most recent feedback that I'm getting. You have to substitute, because the main reason CS was to check your English language proficiency, your communications. Still have to do IELTS.
Okay, sir. Thank you, sir.
No worries.
Sir, Assalamu alaikum. I am a student of second year, Malik Heather.
Nice to meet you.
So, sir, my question is regarding that: is USMLE more?
Sorry, you're cutting off. I can't hear you. Sorry, I can't hear you, Malik.
My question is that, sir, is USMLE more easy to do for a student or pleb, if one can do?
Then plab, you mean the British one? I think plab I've heard is easier. I have a friend actually who did the plab. He went to the UK. I hear plab is easier than the USMLE. That's true, and from what I've heard is that they made it easier for people to come there now because there's such a shortage in the UK. They had the Brexit thing happen, so a lot of the European doctors left. So now that's why they want to take it from other countries. So yeah, plab is easier right now than the USMLE. From what I heard, much easier. For what's it's worth.
Okay, sir. Thanks a lot, sir.
Assalamualaikum, sir.
Waalaikum.
सर ये जीपीए मैटर करती है सर, ये स्टेप 1 2 या 3?
बस एक्सटेंशन नहीं होनी चाहिए. अनलाइक द आर्मी स्टाफ, आप एक्सटेंशन नहीं ले सकते अगर खुदा न खासा क्लासेस फेल हो जाए, वरना आई थिंक डज नॉट मैटर. वो क्या उनके पास कुछ बेंचमार्क नहीं है कंपेयर करने का, पर एज लॉन्ग सम पीपल अनफॉर्चुनेटली पास नहीं कर पाते द प्रॉफ एंड स्टफ, अगर एक्सटेंशन होती है दैट लुक्स अ लिटिल ऑफ ऑन द सीवी.
सर यू मीन अगर किसी स्टूडेंट की सप्ली हो
जैसे पास होना है तो फाइन है
सर, अगर प्रोफेशनल एग्जाम में किसी स्टूडेंट की सप्ली हो तो फिर इसकी मतलब कोई परसेंटेज काटा जाता है इसका सर?
जी सॉरी, आपकी आवाज नहीं आ रही मुझे.
सर मैं ये पूछ रहा था सर कि जैसा कि आपने कहा सर कि अगर सप्ली हो मतलब प्रोफेशनल एग्जाम में किसी स्टूडेंट की सप्ली आई हो तो फिर उसका कोई परसेंटेज काटा जाता है कंबाइंड मेरिट से यूएसएमएलई की?
नहीं, मैं ये कह रहा था कि अगर आपकी एक्सटेंड नहीं कर जाए, जैसे एक साल बढ़ नहीं जाए ग्रेजुएशन ईयर, सप्ली वगैरह उनको शायद इतना पता नहीं लगेगा. उनका तो मेन है कि स्टेप स्कोर है, आपके सीवी क्या है. बहुत कम स्कूल उनको समझ ही नहीं आएगा सिस्टम क्या है क्या नहीं है. स्पेशली हर स्कूल का थोड़ा सा अलग होता है, AQ वर्सेस सम स्कूल इन अफ्रीका उसका अलग होगा, तो वो इतना नहीं होगा. एज लॉन्ग एज आप ज्यादा टाइम ही लगाएं ग्रेजुएशन के लिए, एक्सटेंड नहीं हो फिर वो टफ हो सकता है.
थैंक यू सर.
नो वरीज.
सर ये स्टेप 1 जो है सर, सामने सुना कि ये थर्ड ईयर एमबीबीएस प्रोफेशनल एग्जाम के बाद आप अप्लाई भी कर सकते हो और दे भी सकते हो, क्योंकि फर्स्ट यूएसएमएलई फर्स्ट स्टेप जो है वो बेसिक सब इसमें से होता है. तो सर आप क्या रिकमेंड करते हो, थर्ड ईयर के बाद देनी चाहिए या फाइनल ईयर के बाद जो पूरा प्रोसेस फ्रॉम द वेरी बिगिनिंग यूएसएमएलई स्टेप 1?
जी आई थिंक अब तो खैर प्रेशर कम हो गया स्टेप 1 का, तो आप थर्ड अगर आपने बेसिक कोर्सेज सारे कर लिए हैं, although I'll encourage कि फोर्थ ईयर में करें, you should get some clinical experience. Clinical experience होना चाहिए, it would be easier. और also क्योंकि स्टेप 1 में कुछ क्लिनिकल चीजें थोड़ी बहुत ज्यादा ऐड की, लेकिन अभी भी बेसिक साइंस है भी है. तो I would recommend in fourth year to do that.
सर इसके अलावा जितने भी स्टेप्स होते हैं स्टेप 1 2 3 सर फर्स्ट अटेम्प्ट पर सबको पास करना होगा. मैंने ये भी सुना है कि अगर किसी अटेम्प्ट में आप फेल हो जाओ और बाकी अटेम्प्ट में आप क्लियर करो तो फिर लास्ट में आपको रेजिडेंशिप नहीं मिलती.
बहुत टफ हो जाता है. यू राइट, अनलेस आपका चचा मामा अगर आप स्टेप 1 खुदा न खास्ता फेल हो गया, स्टेप 2 सीख के, तो या दैट्स गोना बी वेरी हार्ड.
Yes sir, thank you sir.
Okay, I would like to thank you sir.
Absolutely.
Naeem, you want to ask something?
Thanks a lot.
Assalamualaikum sir.
Yeah. Walaikum salam.
It's me, Naeem, from first year MBBS. So is there any age limit for USMLE?
There's no age limit. As long as you have a pulse, you're fine. It's not going to be a problem.
Sir, am I audible to you?
Yeah, yes, I can hear you.
Yes, sir. Sir, I'm asking that is there any age limit for USMLE aspirants?
No
Sir? Okay, sir. Okay, sir.
All right. Thank you, guys. I hope you find it helpful, and best of luck for your future. Okay.
Thanks a lot, sir, for giving us such appreciation, sir.
Yeah.
Thank you, sir.
Much appreciated.
Thank you, sir. Thank you.